The following conversation originally aired Wednesday, September 4th, 2019 on the Wednesday Point on KPOV 88.9 FM, High Desert Community Radio in Bend, Oregon. Our guest this morning is Deschutes County's Suicide Prevention Coordinator, Whitney Schumacher. Whitney obtained a Master of Public Health degree in International Health from Oregon State University. Her career to date has focused on substance abuse, violence, and suicide prevention in higher education, secondary education, community, and local government settings. As Deschutes County's Suicide Prevention Coordinator, she currently works to reduce suicide attempts and deaths. She's here today to talk with us about this important topic. Welcome to The Point, Whitney, and thank you for joining us this morning.
Thank you so much for having me. I'm very excited to be here.
We're happy to have you. So, Whitney, could you tell us just a little bit about you and your position at Deschutes County?
Yeah, so like we were talking about before, I am a cat lover, but I also am Deschutes County Suicide Prevention Coordinator. And so my role is to work alongside community organizations and members to reduce suicide attempts and deaths through awareness, education, and policy systems change.
So what is the Central Oregon Suicide Prevention Alliance?
I'm glad you asked. The Central Oregon Suicide Prevention Alliance is a regional grassroots organization that was created through collaborative partnerships among public and private organizations in Deschutes and Jefferson and Crook counties. And so together we implement and monitor programs that promote wellness and the prevention of suicide. And we all know that suicide is such an important public health issue and that no single entity or solution will solve this complex problem. And so we need our communities in the region to work together to reduce suicide attempts and deaths. And that's really what the Central Oregon Suicide Prevention Alliance is all about.
So their resources are available to residents of Crook, Jefferson, and Deschutes County. What types of help do they offer?
We have a comprehensive list of resources available at our website at www.preventsuicideco.org. And there are lists of resources, for example, different phone numbers that people can call depending on what communities they're part of. So maybe a veterans line, Oregon Youth Line. There's also some resources about where to find counseling and even bereavement groups if you've lost someone to suicide.
And overall in Deschutes County, there's been an increase in the rate of suicides, which is also similar to the trend we're seeing at the state level. Deschutes County has the fifth highest overall suicide rate compared to other counties in Oregon. What's being done to address this public health issue?
Yeah, and that data is from the Oregon Violent Death Reporting System, so thanks for sharing that. And what's being done is really using a comprehensive approach to address suicide prevention, intervention, and response. So Central Oregon Suicide Prevention Alliance has partners from all over the region, from various different parts of the community, from law enforcement to hospitals to the schools. And what we're really doing is trying to address suicide prevention from multiple areas. And we're looking at what evidence is telling us what would be the most effective. So, for example, we do things like community trainings. We also provide technical assistance so that organizations can have comprehensive policies on how to support folks that they employ, as well as people that they serve, just to name a few examples.
I'm curious. To me, Deschutes County seems like such a peaceful, bucolic place to live, and yet we're fifth highest in the state for suicides. Why? I'm curious.
You know, I get the why question a lot because I think suicide is such a nuanced public health issue, and suicide has many influences throughout someone's life, so it's never just one single issue. It's a convergence of many different factors. So think about those influences as a combination of things that protect people, things that make folks at risk. So you may hear about risk factors for suicide, also access to lethal means, and someone possessing the capability to take their life. So when we think about all this, I always like to remind folks that when we ask directly about suicide, we can help save someone's life.
So when, for a friend or family, relative, What signs or warning signs should people be looking for?
Yeah, and actually I brought this with me today, the Suicide Prevention Lifeline card. I definitely recommend everybody carry one in their wallet.
And where do we get one of those?
Well, I can give them to you for free, or you can even Google Suicide Prevention Lifeline and order some or download some. But some of the warning signs that is on that card are things like someone feeling trapped or in unbearable pain, talking about being a burden to others, increasing use of alcohol or drugs, withdrawing or isolating someone of their self, and displaying some extreme mood swings, to name just a few. So remember, if you're seeing any of these behaviors in someone that you love, ask them directly if they're thinking about suicide.
Well, that was going to be my next question. I mean, if we see these signs and we're concerned, what should we do?
Well, when we ask directly if someone is thinking about suicide, and they are in fact thinking about suicide, they will almost always feel relieved that you asked them, because
you notice, probably.
Exactly, because now they can finally talk to someone about the feelings that they've been having, and that they don't have to carry that burden alone. Like, the Deschutes County crisis number is something that you can have at the ready as well. So when you ask someone directly, make sure just to know some of the resources on hand, so you can try to persuade them to get help. And a lot of times, getting help can be really scary for someone. And so offering to help them take that first step to getting help is really important as well.
So I just want to repeat what you said, because I know a lot of people would be concerned and not even want to bring it up or mention it. Some people are afraid that if you mention the word suicide, that word alone is a trigger and might make things worse than better. But that's not the case.
Yeah, you're right. It's definitely not the case. That's one of the biggest myths I hear. Asking someone if they are thinking about suicide does not put the idea in their head. A person who is thinking about suicide, who's asked directly, will most likely feel relief, because they can finally talk to someone and they see that someone notices that they are struggling. And so if you notice someone that is struggling and thinking about the warning signs, ask them directly if they're thinking about suicide. You will not put the idea in their head.
Good to know.
Interesting. I'm curious, is there a demographic that is more likely to consider suicide?
What we know to be true is that suicide doesn't discriminate. Anybody from any walk of life can, at some point in their life, struggle with thoughts of suicide.
So no particular age group or...
No.
Okay.
And I've read that suicide is the 10th leading cause of death in the United States, and that it's on the rise. And although, as you said before, there's many complex reasons, it seems as if social isolation is one of those risks. So how can we, as friends and loved ones, better connect with each other?
Yeah. And so when you're noticing that someone isn't acting like their typical self, tell them that you care about them. Ask them how they're feeling. And if you have this gut feeling as you're listening to them openly and non-judgmentally, ask them directly if they're thinking about suicide, because it shows that you care about them. So connect through conversation and really showing someone that it's okay to talk with them about the things that they're feeling.
And so, Whitney, I did want to ask you, untreated mental health issues, conditions ranging from depression and anxiety to bipolar disorder and addiction, can lead people into an emotional spiral, is what I've read. And the Central Oregon, I have this abbreviated here, and I'm not sure what
COSPA.
it is. COSPA website. It lists 29 providers who are not necessarily suicide-specific providers, but rather a comprehensive local list of providers who can help individuals with a variety of mental health challenges. So, unfortunately, only 5 of those providers listed accept Medicare, and 11 accept Pacific Source Oregon Health Plan. What sort of resources are available for those without coverage?
And we often say COSPA, the Central Oregon Suicide Prevention Alliance.
Thank you so much for clearing up with that acronym.
Yeah, I mean, it can be like alphabet soup sometimes, I get it. So in Deschutes County, we have the crisis line, the Deschutes County Behavioral Health Crisis Line. That's available 24 hours a day, 7 days a week. And if you don't know that number, it's 541-322-3737. 7500 option 9. And there's also a walk-in clinic that folks can utilize with the Deschutes County Behavioral Health walk-in clinic. The walk-in clinic is payer blind, meaning they cannot turn anyone away.
Really?
Really. Yeah.
That's really good to know.
So if people don't know where to start, they can always start with Deschutes County Behavioral Health, and they can give ideas on where to find private therapists that work with insurance. Deschutes County Behavioral Health cannot turn anyone away, so it's always a good place to start.
And where is that located?
That's located at 2577 Northeast Courtney Drive in Bend.
So that's over by the hospital.
Yep, over by the hospital.
Okay.
Yeah, and if folks aren't wanting to check out Deschutes County Behavioral Health, we still have other options. There's Lutheran Community Services Northwest. There's the St. Charles Behavioral Health Services area. And we also have Oregon State University Cascades Free Counseling Clinic that's available in both Bend and Lapine. And you can find more information about these resources for each county especially at www.preventsuicideco.org. That's the Central Oregon Suicide Prevention Alliance website.
Whitney, if I could jump back just for a moment. Sure. You mentioned initiating a conversation with someone about suicide. That might be awkward. How would I start that conversation?
I always say start that conversation with asking someone how they're doing. And we always say, being confident and appearing confident are both different things. But if we can appear confident when we're asking someone how they're doing and asking if they are thinking about suicide, it can help someone feel safe enough to be honest. And sometimes we might need to ask more than once if someone is thinking about suicide.
Right. I just wonder if I were to ask someone out of the blue, if they're thinking of suicide, it might be a little awkward. They might want to say, "What? No, of course not. What do you think?" And back away. So
how might one ask?
How do you
so
approach
you're
it?
not getting defenses?
Yes.
Yeah. And so, this all happens in a context of a relationship, right? This is someone that you care about. You can tell them things that you've been noticing. You can tell them that you really care about them and that they can talk to you about how they're feeling. And as you're moving through the conversation, you can ask directly, I've been hearing some of the things you're saying, and I just need to ask, are you thinking about suicide? And maybe the person won't tell you right away, and maybe we need to continue the conversation and ask a different way and ask a couple different times throughout a conversation to make sure that someone knows that they can in fact be honest with you. And if someone says no, then you could say, "Well, I'm so glad that your answer today is no, and I want you to know that if you were ever to feel like you needed to say yes to that question, you can come talk to me."
That's good to know. So another acronym is QPR, which is question, persuade, refer. So I guess that's the first step is to question. So what about the persuade and refer? How do we do that? And talk to us about that one.
Yeah, and QPR, question, persuade, refer, is a great introductory evidence-based training that anybody in the community can take to learn how to talk with someone about suicide. It's one of the many trainings that we offer as part of the Central Oregon Suicide Prevention Alliance. And so if you're interested in more trainings, definitely do check out our website. And so the questioning is all about having that conversation and building rapport. And then persuading is persuading someone to get help. And that help would be what they're comfortable with. Maybe persuading them to call a lifeline, like the Suicide Prevention Lifeline. Maybe persuading them to go with you to the Deschutes County walk-in clinic. So really trying to understand what resources they'd be open to and how they would like to access them. And then referring is all about referring someone to appropriate professional help. Remember, if we are not a counselor, it's not our job to counsel someone. It's our job to refer them to the appropriate resources that are available in our community.
And just for the questioning, if we question them and they say no, absolutely not, and yet we're still very concerned, So is it possible for us to call some of those numbers that are available, the suicide prevention?
Good question.
To ask for help or ask, what can I do? How should I approach this better?
Absolutely. Calling the Suicide Prevention Lifeline, calling the Central Oregon Youth Line, or the Deschutes County Crisis Line is a great way to get some more advice on, this is the situation. I'm not sure if they're being truthful. Do you have some other suggestions as to what I can do? You don't have to be in crisis to use any of those resources. You can also use those resources to get some advice on how you can help someone you love.
Is there information on your website for those of us who are suspicious of a friend that might be considering suicide?
Yeah, if you want information on like different lifelines or numbers to call, definitely check out www.preventsuicideco.org. That's for the Central Oregon Suicide Prevention Alliance. You can also check out the Suicide Prevention Resource Center. That's a great place to start if you're just wanting more information on suicide as a public health issue, different nuances of the topic. It's just a great jumping point because it leads you to other evidence-based resources.
So the Suicide Prevention Center, is that an actual brick and mortar place, or is that someplace online?
The Suicide Prevention Resource Center is a place online, and it's validated by or verified by a bunch of suicide prevention experts in the field.
And you were talking about taking classes, and I did notice that there's a class coming up soon.
Mm-hmm.
Could you talk about that?
Which class? We have many.
Well, the one I saw is at St. Charles in Bend on Tuesday, September 10th from 6:30 to 8 p.m. Mm-hmm. And it was a class, I can't remember the title, but I think it was just general information. I'm not sure.
Yeah, so that event is called True Stories, and it's part of National Suicide Prevention Awareness Week. And that's actually starting this Saturday. It goes from Saturday the 7th to Saturday the 14th. And the Central Oregon Suicide Prevention Alliance, as well as the Suicide Prevention Program with Deschutes County, has coordinated and hosted events for the National Suicide Prevention Awareness Week for the past 5 years. And the goal of that week is to increase awareness of the resources available to everybody in this region and to promote help seeking, because getting help is what we all want folks to do if they're struggling. So the True Stories event, that's next Tuesday at St. Charles at 6:30, is all about how we can talk about suicide with safety at the forefront and hear folks' stories that have been impacted by suicide. Then we also have the Stress Less with Mindfulness class. That's next Wednesday in Redmond at the brand new OSU Extension building.
Oh.
Yeah, it's learning how you can incorporate mindfulness into your everyday life, and it's taught by an OSU Extension professor. Her name is Glenda Hyde. And then on Thursday next week, on the 12th, we also have the Candlelight Vigil, and that's in downtown Bend at the Bend Lapine Schools Education Center front lawn. And that's for individuals or folks that have lost a loved one to suicide, where they can honor the memory of their loved one by lighting a candle at sunset and just being with other folks that have also lost a loved one to suicide.
Is there a place where all of these events are listed?
Yes. So you can go on Facebook and search Central Oregon Suicide Prevention Alliance. We have all of the events posted there. You can also go to www.preventsuicideco.org, and we have all the details you'll need to know for National Suicide Prevention Awareness Week in Deschutes County.
Whitney, is there anything else? We're just about out of time. Is there anything else that you'd like to add?
Yeah, if anybody is wanting to get involved with suicide prevention in Central Oregon, definitely check us out with the Central Oregon Suicide Prevention Alliance. We have lots of ways for folks to get involved, whether it be with National Suicide Prevention Awareness Week or other events, or learn about how we can promote trainings throughout the Central Oregon community. There's just lots of ways to get involved and support suicide prevention in Central Oregon.
Well, thank you so much, Whitney. We are really appreciative of your time this morning.
Oh,
thank you.
Thank you very much.
You've been listening to a KPOV Critical Conversation. To hear more engaging interviews on important topics, please visit kpov.org/critical-conversations.